Hey, thanks so much for joining us. Today we're talking about chronic runny nose. This is so annoying. I have friends who they're constantly carrying around the tissues. They're spending all this money on decongestants and their nose just won't stop running. So we're joined by Dr. Daniel Chiros, who's going to tell us about some new ways to get relief from this. And there's one way in particular that you are treating this, and the effects can potentially be forever, right?
Exactly. And so chronic runny nose can be caused by allergies or for unknown reasons, cold temperatures, exercise, certain foods. And what we're finding is that runny nose and nasal congestion is caused by an overactive nerve at the back of the nose called the posterior nasal nerve.
And now there's a way that you can directly target that.
Exactly. So the new procedure, we target that nerve very precisely with a very quick, safe, relatively painless in-office procedure where we apply a freezing temperature to that nerve, which deadens the effect of those overactive nerve fibers.
Okay, so we all have these nerves, but there's a lot going on in here. So
Exactly.
Can you kind of show us where exactly these nerves are and kind of how the procedure works?
Exactly. Here's the animation. So this is a cutaway now. We're looking at the interior of the nose. Those shelves there, those are called the turbinates. Those are part of the nasal anatomy. And in just a second here, we'll see the nerve fibers. So those yellow fibers, that's the posterior nasal nerve. Again, that's the nerve in the back of the nose. And what we're going to do with this procedure is we're going to apply with a handheld device, which we'll see also in a second.
Yeah, and you know, it could make people a little uneasy to see this because it's going in your nose, but this isn't going to hurt, right?
This isn't going to hurt. We're gonna make sure that nose is numb before we go in with any instrument at all.
Okay, so then you put the instrument in, and what happens from there?
We open a little valve and apply freezing temperatures very precisely, targeting the exact area where that nerve fiber is located in the back of the nose.
Okay, so it's really quick then.
It's very quick. We do it on both sides. Minute or two per side, and that's it.
And then what's the recovery like? Can I go back to work the next day after I have this done?
It's quick, it's safe, it's relatively painless, and yes, you'd be back at work the next day.
And does insurance cover it?
It's covered by most major insurances, that's correct.
All right, your patients who were dealing with a runny nose forever for a variety of reasons, they have to be so happy with this. What are they saying?
Well, they love it. You know, on the one hand, you've got boxes of Kleenexes, antihistamines, decongestants, and nasal steroid sprays. Exactly. And on the other hand, you've got a relatively safe, quick, very effective office procedure to achieve the same thing.
That's awesome. Well, great information. We really appreciate that, Dr. Chiros, and thank you for joining us. We'll see you next time.